Everyone, happy October 1st. And with October 1st, it is Breast Cancer Awareness Month. Hi, I'm Zha-nee. I am a student midwife, and I thought I'd come on here and teach you all how to conduct a breast evaluation on yourself. All my sources are coming from Varney's 6th edition, CDC, as well as a Midwifery Skills Guide that was created by Birthwise University. According to CDC, in 2021, there was 272,452 new cases of people who developed breast cancer. And out of those cases, 42,000 people died. Moving forward throughout this exam, I will be referring to the anatomy as breast. I do understand that some people may not consider themselves as having breasts and refer to it as chest. When starting an exam, you just basically want to do a visual examination. So you are looking for abnormal shapes in the breast. If things are unilateral, so maybe one breast is bigger than the other, you're looking for changes in skin color, dimpling, or kind of like craters in the breast, as well as nipple discharge if you are not a lactating woman or person. Starting this off, you kind of just want to lift your hands above your head, looking at your breasts, looking at those things that kind of outlined it, as well as putting your hands on your hips, leaning forward, and looking at your breasts for those characteristics that I mentioned above. You can just put your hands down and rest it, again, looking at your breasts for those characteristics as I mentioned before. You do want to also lay down and look at your breasts, looking for those characteristics as I mentioned before. When you start the physical portion of the exam, you are wanting to examine your breasts from a sitting position as well as laying down on your back position. When you begin to palpate, you are going to make sure you're using your fingertips, not using your whole hand, as well as not lifting your hands off of the breast as you're moving around different positions, and I'll get into that a little bit later. As we're palpating, we're making sure or looking for lumps. We're looking for the texture, looking for masses. And within those masses, where is it located? Is it on one side? Is it on both sides? Is it a hard consistency? Is it a soft consistency? Can it move around? As well as how big is it? People who are breastfeeding, it is a little bit hard because your milk ducts are kind of in a circular lumpy position, so I would say keep an eye out on that, as well as trying to understand what is the difference between clogged ducts that you may have in your lymph nodes and your breast, as well as what is not normal. There are a few ways or two ways that I want you to do each time when you are palpating. So we're going to start from the upright position. So this is kind of the breast that I'll be using, for example, is divided into 4 quadrants, upper, lower, left, and right, as well as the arm nodule area. So whenever we do it, we want to start from outside and working our way in. So the first method, we're going to kind of starting with my left hand, I'm going to lift up my left hand and put it on my head as is in the picture, and I'm just going to do little small circles starting from the elbow. Just do a little small, going around in a circle, working my way on the outside. Again, I'm not lifting it up, I'm keeping it down. I'm annotating if I'm feeling something, if I'm not feeling something, where I'm feeling it at, and I'm just basically working my way inside to the nipple. That is one way, as well as the second way, again, have my arm up, and it's basically just a zigzag. So start it on the outside, going down in like little hard circles, so that you're not missing anything. So again, you're going down this way, and then it's like a zigzag. You're coming up, and then you're going back down, and then you're coming back up, and then go back down. Again, you're looking for the tenderness, if there's any masses, is any lumps, is it painful in that location. Also take into account if you are breastfeeding or not. Once you do that, go ahead and lay down on your back. Same process, going from the outside, going in and around and around and around and around all the way to your inside, as well as going up and down. So that when you do those two methods, you're giving your chance, just in case if you do one, you kind of potentially miss a lump or a mass or something. So it's giving you two ways that you can kind of detect something if something is there. And then you do the same thing on the other side, starting from outside to the inside. You do want to make sure that you are checking your armpit lymph node area for any masses. So up here as well, all the way into your arm, you're checking that as well to make sure that there is nothing up here. You may be wondering what to do if you feel something or you see something. Go ahead and get in contact with your PCM or your provider right away to see for further testing. If you don't find anything that is really good, just go ahead and test monthly. I will make another video talking about who's at higher risk and not higher risk and kind of what we can do to kind of mitigate that. I hope this is able to help. Happy October 1st.